Hi, my name is Sydney Parrish. I'm a senior psychology major, and my research proposal is on fetal gene therapy and autism spectrum disorders. Fetal gene therapy is a technique used to help prevent or treat various diseases. Treatment will consist of the same procedures as gene therapy, but while the patient is a fetus. The current therapy has only been tested on animals, but could possibly be tested on patients as well. In gene therapy, a gene is carried by a specific vector which delivers the gene by infecting the cell. Autism spectrum disorders consist of several levels of disability. The disorder starts in childhood and lasts a lifetime. Genetics play a role in the cause of autism spectrum disorders, and they can increase the risk of autism as well as other genes that affect the development of the brain. In families where one child has autism, the risk of another with the disorder increases. Researchers are finding that the brains of people with autism spectrum disorders are measurably different. These differences are in the amygdala, the hippocampus, the cerebellum, and the caudate nucleus. Autism spectrum disorders can also impair various physiological aspects. There's delays in gross and fine motor areas, as well as children with autism can show delays of movement, such as sitting up and walking. The proposed study will aim to find if fetal gene therapy can be used to cure autism spectrum disorders. It is important to examine this topic because positive findings could provide future patients with options on curing their disorder. The participants of the proposed study will be randomly selected from an online database. 10 participants will be chosen, and they will be pregnant women who are in their second trimester who either have autism or have a family history of autism. The women will be chosen in their second trimester to ensure that the fetal gene therapy works and goes through. An ATL Ultramark 9 HDMI ultrasound system will be used to examine the fetus. A 3T magnetic imaging machine will be used to examine the brain areas. The 3T magnetic imaging machine will be using the statistical parametric mapping software. An autism diagnostic observation schedule will be conducted as a form of neuropsychological testing. The VSV-G pseudotype lentivirus vector will be inserted into the participant via biolistic particle delivery system. The VSV-G pseudotype lentivirus will be injected into the amniotic fluid. Pictured on the screen in front of you are the two machines that will be used for the proposed study. On the left is the ATL Ultramark 9 HDI ultrasound system, and on the right is the 3T magnetic imaging machine. For the procedure, participants will be given two different dates on when they'll be able to come in for the study. On the first date, participants will be given a pelvic sonogram to assess the normal growth rate of the fetus. On the second date, fetal gene therapy will be executed. The patient will be instructed to change into a gown and given more information about the procedure by a trained surgeon. Once ready for surgery, the patient will be administered propofol as an anesthetic for the patient. Once the patient is sedated, a surgeon will inject the VSV-G pseudotype lentivirus. The VSV-G pseudotype lentivirus is the most commonly used vector for gene therapy, so it will be used for the proposed study. Inserting it into the amniotic fluid reduces the risk of germ-line transfer. Once the transfer is complete, the participant will continue to be monitored and come back 3 weeks later for another sonogram, just to ensure that the pregnancy is going well. After the child is born and it reaches 18 months, the participant will be bringing the infant for an fMRI scan. Participants will be monitored, and at age 6, the child will come in for an autism diagnostic observation schedule. The hope for this proposed study is to find a way to cure autism. Hopefully, fetal gene therapy can provide a new way of treatment by using already existing genetic cells.